In this video, we will aim to identify relevant resources and support for first episode psychosis. First episode psychosis is described in an individual that has difficulty differentiating what is real and what is not. The first episode of psychosis refers to the initial episode in which an individual shows these symptoms. When experiencing psychosis, one's thoughts and perceptions are disturbed and disrupted. They may perceive things that others do not, or hold strong beliefs about things that are not true. To understand psychosis, we must first understand the conditions in which the mind is affected. In this case, there has been some loss of contact with reality. When someone becomes ill in this way, it is called a psychotic episode. During a period of psychosis, a person's thoughts and perceptions are disturbed, and the individual may have difficulty understanding what is real and what is not. This information was provided by the National Institute of Mental Health. What causes psychosis? According to the National Institute of Mental Health, the United States documents roughly 100,000 new cases of psychosis each year. The first episode of psychosis can occur in those in their late teens to mid-20s. This is a time of high stress and rapid changes in the individual's life. There are multiple illnesses where psychosis is a symptom, such as schizophrenia, schizoaffective disorder, and delusional disorders. Other disorders, such as major depression or bipolar disorder, can also include psychosis as a severe secondary symptom. Other causes of psychosis include sleep deprivation, response to general medication, misuse of alcohol or drugs, as well as stress. Symptoms of psychosis can include, but are not limited to, lower quality of performance in academic work or professional areas, newly onset difficulty regarding thinking clearly or concentrating, paranoid thoughts about surroundings, increased suspicions of peers, teachers, or coworkers and their motives, social withdrawal, enthusiasm for strange new ideas, as well as experiencing strange feelings or no feelings at all. Some people with psychosis can also exhibit confused speech or trouble communicating. Delusions, also known as false beliefs, hallucinations, which involve seeing or hearing things, that others do not perceive, inappropriate speech or behavior in certain situations, as well as decline in self-care or personal hygiene. How can the public become aware of substance abuse-related problems like first episode psychosis? We can improve public policies that aim to reduce substance misuse-related problems. This can pertain to rehabilitative programs for those with emerging psychosis symptoms. Effective, evidence-based prevention strategies should be implemented at local youth centers, recreational centers, touring locations, and other areas that these individuals frequent. Another way to improve public policy is to expand insurance coverage for treatment opportunities and offer cost-effective treatment and medication to those in need. Behavioral therapy and medication for treating substance use disorders should be easy to access. We need to increase funding for research and create new evidence-based policies. In 2016, the Surgeon General's report on alcohol, drugs, and health addresses a lot of the issues faced by Americans regarding prevention education. Effective prevention interventions are highly underused. For example, only 8 to 10% of school administrators report using evidence-based interventions to prevent substance misuse. This leaves the majority of the country without in-school prevention programs. This report also claims that only about 11% of youth aged 12 to 17 report participating in a substance abuse program outside of school. Why should we increase funding for substance abuse prevention, treatment, and research? Countless Americans will benefit from the embedding of prevention, treatment, and recovery services into the larger healthcare system. It will increase access to care, improve quality of services, and produce improved outcomes for those with substance abuse issues and their loved ones. Former substance users can then access recovery support services as they achieve and sustain long-term wellness. These evidence-based behavioral and medication-assisted treatments, MAT, can be applied using a chronic illness management approach. They have been shown to facilitate recovery from substance use disorders, prevent relapse, and improve other outcomes, such as reducing criminal behavior and the spread of infectious diseases. One way or another, this research can affect every American. The costs of substance abuse are insurmountable in this country, especially when so many resources are available or can be expanded on. Substance misuse and substance use disorders are estimated to cost society $442 billion each year in healthcare-related costs, lost productivity, and criminal justice costs. However, numerous evidence-based prevention and treatment policies and programs can be implemented to reduce these costs while improving health and wellness. More than 10 million full-time workers in our nation have a substance use disorder, a leading cause of disability. Studies have demonstrated that prevention and treatment programs for employees with substance use disorders are cost-effective in improving worker productivity. What can be done to strengthen existing relationships and access to treatment? One study by Fraser, Berger, and McGorry addresses the importance of the general practitioner when helping those with emerging psychosis. The use of a multidisciplinary team can optimize the management of emerging psychotic disorders in young people. This can include the general practitioner and youth-friendly specialists in mental health. This team ideally has expertise in early intervention and should be able to treat these patients for the initial 2 to 5 years since the onset of psychosis. However, these services are not always accessible. The GP may have to be the sole resource for some individual. They can initiate management of the young patient themselves. As the evidence base consistently supports early intervention, they can aim to reduce the duration of untreated psychosis. This can in turn lead to minimalizing social and cognitive incapacity in order to improve the overall outcome. The role of the GP adopts a shared care model with specialist mental health services. From initial recognition of the psychotic illness to continuing care and relapse prevention, the GP should be involved in supporting the patient and their family. Online resources are available through the National Institute of Mental Health. The first resource they recommend is the Early Assessment and Support Alliance. They offer National Early Psychosis Directory that lists early psychosis programs nationwide. Another available resource is the National Alliance on Mental Illness. The NAMI helpline can connect you with the office in your state and help you find programs close to home. You can also talk with someone over the phone by calling 1-800-950-6264 from Monday through Friday from 10 a.m. to 6 p.m. The Prodrome and Early Psychosis Program supports a national network of programs providing services to people who are at risk for or are experiencing early psychosis. The Substance Abuse and Mental Health Services Administration is also a great resource for locating mental health treatment facilities and programs that are local to you.